Hi, my name is Zion Johnson, and today I'll be doing my colostomy bag changing assessment video. So to begin with, I will first knock on my patient's door, and I will come inside and close my patient's door to provide privacy, and then I will introduce myself and express what we're going to be doing today. Hi, Ms. Jones. My name is Zion. I'm going to be your nurse today, and today I will be doing your colostomy bag change. May I have your first and last name and date of birth? And I will also check their name tag, their wristband, to make sure that they are the correct patient, and I will do hand hygiene and apply some gloves. So because I only have one colostomy bag and waffle, I will only be using these ones that are applied, just because I only have one set and it's in use at the moment. But we'll pretend that this is new. Okay, so first, to begin with, I will remove my patient's colostomy bag, and I will empty into the basin. And usually I would toss it with my patient's fluids, but because we're reusing this bag, I'm going to place it back down and pretend that it's not been used. So I'll remove the basin to create some space, and then I will remove my patient's waffle, very carefully peeling up from the skin, making sure not to tug, and then we will remove, and it will be reused again, just because again we don't have another to use. So then I will remove my gloves, and I will perform hand hygiene. And I'll apply a new set of gloves and begin the process of sterilizing my patient's, or cleaning my patient's stoma and applying a new colostomy bag. Okay. So to begin with, I will take a washcloth with warm water and recommended soap, and I will dab my patient's stoma clean, making sure to check for any drainage, any purulence, make sure that it's healing correctly, and I'll make sure that it's beefy and red, making sure that there's not any excess blood. A little blood is okay, but if there's excess blood, I need to inform the provider immediately. And so then next, after, I'll take a dry cloth and I'll dab my stoma clean. Okay. And then I will take my my stoma guide and I will take a pen and I will I will take my stoma guide and I'll compare it to my patient's stoma, making sure that there's enough clearance for the colostomy bag and the waffle to sit snugly on my patient's stoma without constricting it, causing it to become cyanotic, and without leaving too much space so that any of my patient's fluids do not start to break down their skin around the stoma. So I will first try the 1 1/4, and that's a little too big. So I'll go to the 1 3/8, and that size seems to be a good enough size to where there's enough space for my patient. And then next I will go and place it on my patient's waffle, where I will take a pen and I will outline my patient's stoma circle, and I will cut on my patient's stomach. Okay. And then next, I will place it over my patient's stomach. I will take their new colostomy bag. I'll remove the sealant. Actually, before it's applied, I have to apply their sealant to my patient's stoma guide and apply it to the waffle, spreading from the center out towards the edges, making sure that there's a seal for my patient. Next, I will place their colostomy bag onto their waffle until it snaps into place. And then I will roll their colostomy bag upwards so that it does not leak. And I'll seal it, their tabs. And I will sit my patient back up in a comfortable position and ask them if they need anything else before I go and document their colostomy bag change. Ms. Jones, did you need anything else before I take off to go inform your doctor or your provider of your colostomy bag change? No, thank you. Thank you for your time. Your call light is right here in front of you, and I will be documenting everything and informing your provider. I'll remove my gloves and perform hand hygiene. And I will walk out of my patient's room and document timing, date, and any signs of or all of the characteristics of my patient's stoma in their documents so that the provider can know ahead of time how their stoma is healing. And thank you for your time.